Hello everyone, welcome to ANP Science and Pharma. In the field of healthcare, medicines plays an important role, right? Not only in healthcare, in our day-to-day life also, we often use medicines to treat different health problems like fever, pain, infections, diabetes, etc. Right? But have you ever thought how these medicines work inside our body and how the medicine or tablet knows exactly where to show their action in the body? To explain this today, we are going to learn a new and interesting subject called pharmacology. In this video, I will explain you the basics of pharmacology. Let us understand what pharmacology means. Usually, the word pharmacology is derived from Greek word pharmakon means drug, logos means to study. In pharmacology, medicines are referred as drugs. So, throughout this lecture, the word drug means medicine. Here, let us see the definition of pharmacology. Usually, pharmacology is the branch of science that deals with the study of drugs, their interactions with the living systems. It explains how the drugs work inside our body and how our body responds to the drugs and how medicines helps in treating diseases and how the drugs will show adverse effects, side effects, toxic effects, right? Pharmacology forms the foundation of drug rational therapy. What is the meaning of foundation of drug rational therapy? Means using the right medicine in the right dose for the right patient. When we see the importance of pharmacology, why we need to study pharmacology means pharmacology is important because it helps us in understanding safe and effective use of drugs, selection of correct dose of drug, prevention of adverse drug reactions, and avoidance of drug interactions. Let me explain you this with simple example. For example, if a patient has fever, right, we should give a medicine mean for fever like paracetamol, not an antibiotic without reason. This is called choosing right medicine, which is safe, which shows effective use. If the dose is correct, for example, if the dose is low, the medicine will not work. So we have to give the dose of the drug. If the dose is high, it will causes harmful effects. And one more thing, at the same time, same medicine may not be suitable for every patient. Some drugs are not safe for children and for pregnant women. And this correct decision making comes from the knowledge of pharmacology. That's why pharmacology is very important subject. From starting onwards, I am saying drug. Now let us see the definition of drug. A drug is nothing but a chemical substance which is used to prevent diseases, to diagnose, and to cure the diseases. Some of the examples of drug are paracetamol. Paracetamol is one of the drug which is used to reduce fever and pain. Insulin, it is also one of the drug which is used to treat diabetes mellitus. Antibiotics, it is used to treat infections. Like that, there are so many examples which will cure or treat the disease. So this is called the definition of drug. Pharmacology is a vast subject, so it is divided into branches. So each branch will study drug in different angles. It is divided into two branches. One is pharmacodynamics and the other is pharmacokinetics. Now let us see what is pharmacodynamics. Pharmacodynamics usually it tells us what a drug does to the body. For example, when a medicine enters into the body, it needs a correct or specific place to show its action. If it finds a specific place, then only it will show its action. That place is called as receptor. You can imagine receptor as a lock and medicine as a key. When correct key fits, then the medicine works. Let me tell you with example. For example, when we give paracetamol to treat fever, to reduce fever, when we give paracetamol tablet for the patient, it will act at a specific place in the brain. In the brain, there is thermoregulatory center. The paracetamol will act in that center in the brain and it reduces fever. This is how the medicine or the drug shows its mechanism of action. This is what the pharmacodynamics will explain. Next, pharmacokinetics. Pharmacokinetics means it explains what the body does to the drug. Uh, Usually, a medicine doesn't stay in body forever, right? After taking medicine, it, what happens in our body means, for example, when we give paracetamol or aspirin tablet to the person, what happens? The tablet will enter into the stomach. From the stomach, it will enter into the bloodstream. That process is called absorption. After absorbing through the blood, the medicine will travels to different organs. That process is called distribution. After distribution, it reaches to the liver for metabolism purpose. What is metabolism means? It is the process of breaking down the medicine into simpler and safe forms. So the medicine becomes less harmful and easier to remove from the body. After metabolism process finished, then it reaches to the kidney. From the kidney in the form of urine, it will get eliminated from the body. Okay, this is what pharmacokinetic explains. It explains absorption, distribution, metabolism, and excretion. Overall, it explains the entire journey of drug in the body. It will explain the entry of drug and the exit of drug. This is called pharmacokinetics. Thank you.